We're going to try to get started in about 2 minutes. 2 minutes. Okay, good morning, everyone. Welcome to the second day of the City Council's 26-27 budget hearings. Since we have folks in order, in place, I'd ask the clerk to call the roll for the Budget, Finance, and Governance Committee.
Councilmember Gruber.
Here.
Councilmember Martin.
Here.
Councilmember Smith.
Here.
Vice President Harris. President Melendez.
Here.
Thank you.
Thanks. And we're joined by Council Members Leslie Smith and Lupien. And I believe we'll be joined by the rest of Council at some point over the course of the day. We're streaming today's hearings live on our social media and WXXI. Thank you for being here. They're broadcasting as well. This morning, we'll begin the hearings with undistributed and contingency, followed by the Emergency Communications Department, and then we'll conclude our morning hearings with the Department of Recreation and Human Services before breaking for lunch. This afternoon, we'll hear from the Fire Department, and then we'll conclude today's hearings with the Police Department. So we're going to start with undistributed and contingency. Let's do them one at a time. We'll start with undistributed, which is the 13th section of the budget book. And I'll start by asking the mayor or the budget director just to share any kind of framing remarks around what is in undistributed this year.
No framing remarks. I'm sorry, Suzanne. I thought you guys were.
I think you will see that this is the department and area where we are seeing the most budgetary pressure, primarily consisting of increases in pension and healthcare. We will take your questions, try to educate you on anything we know. Thank you.
And so these costs, pension and healthcare costs, are always in undistributed at the beginning of the budget year.
That's correct.
Okay. So we talked a little bit yesterday about the amortization of pension costs, and we talked a little bit about the plans to re-examine healthcare costs, but this is a good time for folks to ask any follow-up questions about those two subjects if they have any. President Melendez?
Yes, thank you, Chair Gruber. Just looking at the medical costs, and I'm sure this tracks with what we're seeing nationally, but from 2022 and then the projection in 2032, so 10 years later, it's going to almost double. And nothing really has changed in our plans and in terms of what we offer and those kind of things. I mean, it's little nuanced things here and there, but it's just the cost of medical is just outrageous. So the question is, in terms of the negotiating table, this is something that would go back to the committee, the healthcare committee, to have further discussion. And I guess, what is the administration's posture at this point in terms of trying to drive down costs?
Yeah, I mean, it's all stated for negotiation. That's our posture. We don't have anything forward on grand plan that we have. We're aware our unions are listening that these changes or conversations we're having related to healthcare will take place and we will go back on what progress we make. I'll just go back to what I said yesterday. Our overall goal is that we have to find a way to save dollars on medical costs. Don't we'll continue down an unsustainable path.
Given the challenge, has there been, and this is probably, well, this definitely is bigger than just the city of Rochester, right? So has there been any discussions at the state level about what more? I know the state budget just passed, didn't really include much in the framing of medical expenses, but is this something that we could also have conversations with the state about? Receiving additional aid?
I mean, possibly. I think they're very much aware of the rising medical and pension. I think that's why we were able to make the case, particularly for us getting $35 million more dollars, which, by the way, is the biggest increase has gotten probably in a generation, because they are aware of the rising costs that all municipalities are facing, not just Rochester. So I think that is a conversation, particularly with the changes that they're going to be making to Tier 6. I think all municipalities would be in a position to say, being that you expect changes, they need to be funded somehow. So state aid could find a way to be able to do that. But the medical costs are, particularly the retiree medical costs, are something that are really, really.
Mayor Evans, they can't hear you online. I'm sorry.
Okay. The medical costs are really, really putting a major strain on the budget, and you see that here in this line item. I think we up 40. Is it 45% in 5 years? Medical. Yeah, and as you said, President Melendez, double in the next couple of years. So we gotta figure out a way to make it sustainable, because we have a great program, and lots of folks we talk to think that we can continue to make it sustainable, but we gotta address the review, which we have not done in almost 17 years. This has not been looked at in 17 years, and it's time to have those discussions, which we will be having.
And my last question here, personnel costs are increasing by $16.8 million. And I know that we've cut 40 plus positions out of the budget this year. So how much of that is driven by either step increases or changes in the position number, for going up in salary, versus benefit cost increases?
Thank you for that question. Let me try to speak right into the mic here. So personnel in undistributed includes all of the benefits costs. We categorize those as personnel in that major object table. So that's going to include a little bit of increase in Social Security. Even though we're down in positions, the wages are up. So there was a little increase in FICA, Social Security, but most of it is that healthcare.
Got it. Thank you.
Both current employee and retiree healthcare.
Are there, first, just for the sake of level setting, will you just explain the concept of being self-insured versus how many employers work? Someone just explain that concept.
Our program is governed by the Labor Management Healthcare Committee. So there are representatives of the administration as well as representatives of each union. They have selected essentially a third-party carrier to manage the program, and we pay into the insurance company, quote unquote, end quote, and so we pay premiums for both active and retirees. That money is deposited into the fund. Then MVP manages the program by paying all the claims, managing the claims, administrative costs, things of that nature. At the end of the day, there is one fund through which that is all managed and is on the city's books as our health insurance fund, self-insured health insurance fund.
Got it. And I don't think I can express enough how incredibly good the city's benefit. Wow. I didn't realize the clerk had private secret buttons on her.
That's good to know.
At her desk.
Hey, I didn't know that. You gotta.
Wow.
Hazel, I'll give you this. Next time, I'll give you the clue.
The weight stays on, but the mic stops working. It's a real. That's power, Hazel. The city's benefits are just remarkably good, and I think that needs to be stated up front that there's a reason why the costs are significant. It's because the city takes care of their employees, and the city sees it as an opportunity to really recruit and retain employees. But I am curious, are there other municipalities that are self-insured? Is this a rare thing?
It's not that rare. In fact, the county is self-insured for healthcare, among others. RGRTA is self-insured for healthcare, so it's fairly common. And I think when it works well.
Sorry, Mike, Deputy Mayor.
How does that sound?
Good.
All right.
Thanks.
Between that and my outside voice, I think we'll make this work. So municipalities being self-insured is not uncommon. So Monroe County would be a great example. RGRTA would be another great example. So it's fairly common.
Is there, big picture, is being self-insured more about having more, maybe that's the wrong way to frame it. Being self-insured, I assume, gives us more control over a lot of elements. Is there analysis of how it compares from a cost perspective?
Yeah, so it does give us more control. I think as far as a recent analysis, that's probably not been done since we went self-insured back in 2009. I think it's important to note plan design has not changed at all since 2009. The condition of the self-insured healthcare program and any cost levers or other actions that we might take is periodically reviewed by the committee. I think where this has really become an issue is post-COVID, right? That's where we've seen the spike in the last 5 years, and I think that's why this issue of skyrocketing healthcare costs has really come to the forefront each year, seemingly more so than the one before it.
Got it.
Just want to provide that context.
Thank you. Appreciate it. Do folks have other questions about healthcare? Councilmember Leslie Smith? Oh, well, sure. About anything. Go ahead.
For one, I want to just say to the administration that I can really appreciate the conundrum that you're all in, and thank you for doing everything that you can to try to assist our city in being fiscally responsible. I have a question just about the how the undistributed section is just sectioned out. Has there ever been a time or are there data for the healthcare costs, the pension costs, and anything else that's related here that is department specific, so that we can see how, where the breakdown and where the increased cost is across departments?
That's a great question. Yes, it's not a very interesting name for a department, undistributed, but it does mean that we don't distribute these expenses across the departments. But we do have underlying data for all of these items, in particular for pension and healthcare. We do have to split these expenses by fund. The city has 10 funds, and so we have to be sure to charge the funds accurately at the end of the year, but we also have the information by department.
Can you provide that in writing?
I was going to say, on page 46 in the summary section, we make an effort to assign a benefit cost by department.
Perfect. Thank you.
Councilmember Martin?
Around general risk management, is this where I'd find information on the insurance reserves?
Yes, that's correct.
So can you actually explain how the whole insurance reserves process works?
I can speak to what's in here, and then I might turn it to Corporation Counsel or others to give you more information.
Thank you.
Okay, so what's in undistributed is some years we deliberately budget an amount that we can hopefully at the end of the year, if it turns out well, put into the insurance reserve. So this coming year we added $1 million. It shows up as $994 because there are other adjustments to other funds, but essentially we budgeted $1 million of general fund money to put into the insurance reserve at the end of next year, hopefully. As far as more detail on the insurance reserve, though, I think I'll turn it over to our Corporation Counsel.
Here I am. No bow tie today.
And
Sorry
can you point me to what page I would find more?
It's just page 6 has some information about that number, and it shows the year-to-year comparison table indicates that the insurance reserve reimbursement increased due to a planned contribution. You see that at the top of page 6?
Yes.
Okay.
Okay. I was making sure I was looking at the right spot. Thank you.
I just want to remind council as well that our general liability self-insurance fund is an off-budget fund, so it is not represented within this book because it's not an operating budget fund.
So to Suzanne's point, I think what we can do, Councilmember Martin, is get you something in writing that explains how it's an off-budget fund, how it's funded, and how we appropriate money into it as we're looking at potential liabilities related to claims and suits that we receive.
Thank you. And just for my own understanding, is it an off-budget fund in the same way council has the council priority off-budget fund?
No, that's general fund. So that's an operating budget fund, the general fund.
Can you, sorry, I don't understand. Say more to
okay.
Yeah.
So we have operating budgets and 10 funds that we budget for annually. And that's what this budget book represents, is budgeting annually for those 10 operating budgets. We have many different off-budget funds that are different categories as determined by the general, the standards board for accounting, governmental accounting. And so we have like city treasurer and trust. There is the self-insurance fund for general liability, as well as self-insurance for healthcare.
Okay, that's really helpful. And like Patrick said, in writing would be helpful to see, I guess, all the off-budget funds and how much is in them within the last 4 years, the variances. Thank you.
Councilmember Lupien?
Yes. So given that benefits are an issue looking forward, that we're not really sure how we're going to be able to cover the rising cost, is the city and perhaps joining with other cities in supporting the New Earth Health Act?
I missed the last half of your question.
I think this is more of a Mayor Evans question.
Talk about the New York Health Act.
That's healthcare for all. That way, the city wouldn't be on the hook for employee benefits.
Yeah, we haven't thought about that, but
I mean, I think we're getting up to the wall, right?
If it keeps going the way it is, we're going to have to be open to everything. But we haven't had specific conversations about the New York.
Maybe that's something the council, if there's will and the administration can work together on. Is there anywhere in the budget where the pensions and benefits are broken down by department?
That was the page 46 in the summary
Oh, it
section.
is. Yep. Thank you. And is there a plan for participatory budgeting? I know we talked about that in other years.
Yeah, I mean, I always set aside some money for that. We haven't done anything. We shifted kind of to NIA as a focus, but that's still something that I have in my in the mayor's office that we always put aside something for if something comes up and we want to do something. So it's always on a possibility.
Is there money currently set aside, or is that kind of like a future thing that you might do?
Do I have?
No.
So I don't have this year. I don't have. 2 years ago, I set aside an amount for it, but it's not something. It's still something that we could find if it's something I wanted to do. I could find money within this existing budget to do it. It would be small because of what we're dealing with, but
like a couple $100,000.
Yeah. Right.
Yeah. Okay.
Like or less.
And are there any one-time costs in undistributed for this year that we wouldn't reoccur?
The only one I can think of, grants, of course, are never certain going forward, but so the AmeriCorps could change year over year. There's $3,000, I think, for CityMark in 27 that will end. Most of it was in the current year and was reduced, but a small amount is carrying into fiscal 27. I think that's all I can think of right now.
Okay, thank you. And lastly, Councilmember Martin had asked for some information about the liability off book fund. Could you also include the amount that's in it? Thank you.
I'm sorry. I'm sorry. Can you the amount that's in?
Yeah, I think Corporation Counsel had mentioned, a bunch of other aspects about how the money gets into it and what decisions are made, but also the balance. Yep.
Gotcha. Okay. Thank you.
We talked yesterday for a while about the amortizing of pension costs. Can you just share? I think the mayor mentioned that New York City has also done this. Are all the big five doing this right now?
I think New York City's might be different. I think that's a deferral of their payment. Yeah, so in other words, without interest, they're just being allowed to pay it later. Oh, there's interest? Oh. For us, there will be interest, and we're starting to run those numbers now because I know that's something of interest to you. So we're running some calculations now on that. I don't know whether other cities are doing it. We could check. We can check and see if some of the other big five are planning to amortize or not.
Yeah, I would be curious to know if any of everyone has the same
problems,
concerns right now in terms of rising pension costs. They're not unique to Rochester at all. So I would like to understand if there are other cities doing it. I'm also curious, how is the number selected for how much we're deciding to amortize?
So that's a number that the state comptroller calculates. It has to do with the system rate statewide, and there were graded rates for a while. So they look at our actual rate, so our total pension bill divided by our total salaries, and that's the rate that we're paying. And they look to see how it compares to a statewide average. And if there's a gap, then we're allowed to amortize the difference.
Oh,
that's the short story.
So basically, the comptroller tells us what we can or
us.
cannot amortize.
Yes.
We just don't say, we want to do this tomorrow. We have to confer with the comptroller.
And so we're amortizing the maximum amount that we're allowed to amortize.
That is the maximum for the police and fire pension system. Yes.
Got it. So we can do it differently for different employee sets.
I'm sorry.
We could choose to amortize for different employee sets. We're choosing to amortize there.
Yes, exactly. So there's two systems. One is ERS, that's all our civilians, and one is PFRS, which is police fire. So that's our sworn and uniformed employees, and they have very different rates, and just a lot of things about them are very different. So the PF in this case is the $9 million and change amortization opportunity. I think ERS was under $1 million. So we decided not to amortize that.
And just for the record, the different rates are again set by the state, not by us.
Yes, every year. So we don't even know the rates for fiscal 27-28 yet. We'll get those in August in the form of a projected bill with all the new rates, which will presumably have a change for the Tier 6 changes that were just passed yesterday.
Got it. Okay. Any last questions on undistributed? Councilor Martin?
Which departments have the highest pension cost?
Probably police and fire, right? Yeah, police and fire, definitely, because they're 20 years, they've been working and they're out, so you're paying more.
Thank you.
Okay, let's move over to contingency. And if you just want to, Suzanne or Sarah, if either of you would just explain essentially what is the 1.6-ish variance?
We usually do not divulge exactly what that number represents. This is our assessment of the unbudgeted expenditures, things that are hard to assess at the time.
Got it.
We do not spend money directly out of this budget. The only way that this would be spent is by a budget amendment that we would bring to council to move money to a different department.
And obviously, if that were to happen, there'd be specifics of what it's paying for.
Correct.
Councilmember Leslie Smith.
Suzanne, maybe perhaps this is a clarification, and maybe you meant exactly what you said when you say you do not divulge. What you're saying exactly is you don't know just yet.
Correct.
Okay, got it. Thank you.
Yeah.
And historically, I don't think this is what's placed here for this amount, and I don't think we have any labor agreements right now, but historically there's money in here to address any gaps between negotiating.
Correct.
Okay. But right now we have no open contracts. Or we
Fire expires June 30th.
Okay, thank you. Councilmember Martin?
I want to go back to off-budget funds. Is there any way the public can see what's there? Is it kept a secret for a reason?
They're not a secret. The office, the Office of Management and Budget manages the operating budget. So these 10 on-budget funds, operating budget, the off-budget funds are managed by the Department of Finance, typically within the Bureau of Accounting, and those are represented in the annual comprehensive financial report that is released each year.
Thank you. And for the contingencies in writing, could you provide just a list of what it was used for, if any was used last year?
Sure.
Thank you.
Any last questions on contingency? Councilmember Smith?
So when we think about some of the issues in communities, such as like homelessness and encampments, are there times, or has there been times, can you use contingency funds to address any of those issues? And another question specifically for the mayor. Mayor, I know you have a really good, seemingly a really good relationship with Adam Bello, and I'm just wondering, are there any conversations about how we can collectively work together to address some of these needs, which we know are not just the needs of the city as it pertains to encampments and homelessness?
Yeah, I mean, I think we would not move any of these monies. I mean, sometimes undistributed, we might use some dollars out of there for that, but usually not. We try not to. We try to make sure we plan and budget within the budget that council approves during this time frame. So you'll see some of those dollars in the Department of Recreation and Human Services. We budget for PIC and items like that. But we also have used our opioid settlement dollars. That's where our ambassador program is funded out of to address some of those issues. And in terms of the county, we work very closely with them because they are the leaders of they are the folks that are charged with taking the lead of homelessness and substance abuse in our community, because they have the Department of Health and they have the Department of Human Services. So yes, we work very closely with them on our poverty issue. That the money that we got from the state, the $25 million that's flowing to single mothers, for example, to address poverty, that we work with them on that plan, and that money that came through OTDA that flowed through the county, and we work together to see how that's being done. So, and in terms of housing, they gave us some of their ARPA funds for home ownership and affordable housing. That money, the county, we did an intermunicipal agreement with them a couple of months ago, and that money came to them. So this issue that you just raised cannot be done just by the city alone. So you really have to work with the county, just not the county, but also the state and federal government also play a role there. We talked about HUD funding last year. Some of those dollars are used to address those things that you mentioned as well, and those items you'll see next month in your legislation packet, and that's CDBG dollars, Community Development Block Grant dollars, that are coming from the federal government. So we try to work with all levels of government to address these issues, because that's the only way you really can solve it. Because the city's budget is just not even close to the size of the school district, the county, or the state. Their budget is much bigger than ours. So we have to rely on them to make sure that they give us dollars or do the work in those areas to help solve some of the challenges that we have. And I'll point out that this budget is chock full of things that technically we're not responsible for, but we are responsible for, if you know what I mean. Because people come to us when they see them in our neighborhoods, and although we are not compensated for them, we don't get money for them, we do them because they're the right things to do for our community, and that's why you'll see them in the budget. PIC is a prime example of it. We get no reimbursement for PIC yet. That's our push next year, is to try to get Medicaid reimbursement for PIC, so we can even do more, because it's proven that it's been so successful that if we ever tried to get rid of PIC, people in the county would say, "What are you doing?" They like our approach, and that's why we've expanded it, even though we don't have the dollars to do it. So that comes out of general operating dollars. Think about if another organization was doing that, they'd be able to get reimbursement from Medicaid or the state or healthcare reimbursement. We get no reimbursement. So that's an opportunity as we look at trying to find ways for revenue and try to get reimbursement. We could do that, but that's a long way of me saying that we have to be creative in how we some of those dollars. And it's why we sue a lot. We get sued a lot, but we also sue a lot. So we always try to get money also from lawsuits.
Yes, we do.
But seriously, I mean, that's what helps. I mean, the opioid money, to address that opioid crisis that, you know, a lot of people don't talk about it, that was caused by large companies that got people addicted to drugs, period. So we sued them. And now we're using those dollars to fix what they did to try to change things a little bit. So that's also part of our strategy as well.
Since you raised lawsuits, I noticed not necessarily exactly relevant to the sections, but somewhere in the budget there's a note about the Kia and Hyundai lawsuits. Can you just talk about that for a second?
Yeah, I see, and this is like, I don't like to prove when I'm right, but Patrick, if you remember when we said we were going to sue Kia and Hyundai, people were like, "Oh, he's just making an excuse for these kids stealing cars." Mm-hmm. But just to back up a little bit, if anybody remembers that Kia and Hyundai lawsuit, when we decided to sue them, and I was in the atrium, we decided to sue them because Kia and Hyundai are the cars of working class people. If you drive a Cadillac or a Lexus or whatever, it is almost impossible to steal your car. Now, you can steal it, but you got to work hard at it. Kia and Hyundai, if you remember, they had a easy thing where you could, I don't want to tell you what you could do. I hope they fixed it, but you basically could.
I don't think it's a secret. There was
a video.
Yeah.
President Melendez is smiling like he tried it out. I think
man's got a lot of USB cords in his car.
I've seen him with the USB cord. But, you know, you could take a USB cord and just exploit it. So we said that's ridiculous. Remember, car thefts declined like in the early 90s and early 2000s. There was like no car thefts. But they made these great cars. They were cheaper. A lot of the folks that got them, working class folks, bought these cars, and they had their cars stolen. So we had this idea, and we said, they didn't have to make these cars this easy to steal. We're spending police time. We got residents that are being, you know, shortchanged. Enough of my friends and family have had their cars stolen. I said, let's sue them. So we joined a class action lawsuit. We sued them. And I believe that we are very close to settlement on that. Right?
That's right. We're very close. It's not final yet.
It's not final. But so that's why. So that's what's reflected in this budget is this settling. So I think that it sends an example. Now, we still also have our lawsuit against Glock.
Right? Yep. We have a firearm lawsuit against a number of manufacturers, including Glock.
So those are all things that we are trying to recoup dollars on. But to answer your question about the Kia and Hyundai, that is reflected in this budget in the possible settlement that we may get.
And the dollar amount that's listed in here is what you anticipate the settlement to be. But can I ask, is it what you had hoped the settlement would be?
Listen, it's for me personally, I think it's let me say I'm satisfied. I'm satisfied.
Patrick,
yeah, I think
Patrick looks less satisfied.
No. That's not right at all. There's risk in any litigation, right? And as the mayor said, when we filed this thing, and certainly the defense from Kia Hyundai was, "Hey, not us. This is a bunch of stupid kids stealing cars, right? We didn't make them steal the cars." The issue was the electronic ignition, which they decided to leave off of these lower end models, which is industry standard. So we really didn't know. This was an untested theory. We didn't know if there'd be any reward at the end of this thing, right? So I think we're very happy with the number we've been talking around.
Great.
And trust me, the person who's Councilman Gruber, the person who's least satisfied with lawsuits and stuff is usually me. I'm usually beating Patrick up because I want more. So if I say I'm satisfied, that means something.
I will say too, just to add to this affirmative litigation love fest, we've recently joined two other larger lawsuits, one challenging some antitrust issues in the fire apparatus industry. Prices for fire trucks have gone way, way up, and so we've joined a suit that challenges that pricing. And also turnout gear for firefighters, which historically has had PFAS chemicals in them. We've joined a class action to challenge that as well.
Thanks for that. Any last questions on these two sections? If not, thank you very much. And do we know, are the folks from Emergency Communications here?
Call 311. They'll let you know if they're on air.
Okay, thanks, Emily. I always have lots of questions for Tom. Okay, we are going to get started with our Emergency Communications budget hearing. Just to direct everyone's attention to the right tab, we're in tab 8. And let me turn it over to Director Soretto for any opening remarks and to introduce his team. Good morning.
Is that better? So I'd like to introduce my team. To my right, I have
Deputy Director Greg Roney. My number 2 at the center. Behind me I have my Manager of Administration, Tammy Jo Sardu. Manager of 311, Craig Spade. My 3 operations managers, Mark Deisenroth, Sherry Landers, and Matt Johnson. Senior Administrative Analyst. Oh. Yep. Okay. Sorry about that. Senior Administrative Analyst, Tiffany St. Alban. Training Manager, Chris Buss. And my Application Analyst, Tim Keller. Before we start, I would just like to say a few things regarding something I'm pretty proud of my staff. For those of you that are not aware, in December of 2024, we were down 62 full-time positions at the 911 center, which was a very large portion of our staff. In July 1st of this year, we anticipate being down just 9 positions. So we've made a lot of strides in that area in coordination with HR, and the people in this room on my staff and people at the center have worked very hard to make this possible, and I just wanted to publicly acknowledge the work that they've done. So,
that's tremendously good news. I think it's been the last 3 or 4 budget hearings that we've had where staffing has been the number one and maybe only major concern of this department. What do you attribute obviously everyone's hard work for sure, but are there other individual things that you can point to?
on a very close basis, helped us streamline the process for hiring, utilizing the state help program, which I'm sure you've heard of in this room. But that itself took about 4 months off the process. We streamlined the remaining process by having our own background investigators. So ECD is the priority for them, other than having them done elsewhere where we're not the number one priority. We've made arrangements with the psychologist that we can provide on-site testing for him, which allows it easier for our applicants to have better opportunities to show up. It's a lot less difficult for them to show up. And anything we can do to help our applicants understand the process moving forward. We have my staff constantly reaches out for people that maybe didn't submit a form on time or didn't show up. We give them other chances because we are trying to do what we can to bring the best people we can forward to work at the center. And I think if you look at our turnover rate, 3 years ago it was at 19, last year it was at 14, this year it's at 8. And I think because of the way we're bringing people in, we're using the help program, we're bringing them in at the TCC position, and before we move them up via the help program to the dispatcher position, we give them time to be comfortable in their job, so they're way more comfortable. They're not getting mandated the hours because we have staff now. So they're way more comfortable in the position before they move up to the next level position of a dispatcher, and I think it's really helping us keep people. The deputy director here set up a program for all our new trainees where they have to, about a year old now, where we have an open house with their families. It gives the families a very good understanding of what their relatives will be dealing with on a daily basis at the center. So they can give them the proper support when they go home. On top of that, we also it also helps us explain to the families the very good job that their relatives has just acquired, and maybe they'll help them support them in this keeping it. So I think that's worked very well to help stem that tide, and I think the turnover rate is really one of the best accomplishments so far.
Yeah, that's amazing. So obviously you want to fill those last 9 positions, but it's safe to say that the department is not in a state of crisis at this point, like you once were.
That's correct.
And I assume that similarly with the stability and staffing, some of the obviously 911 has to be staffed all the time. So there's a lot less mandatory overtime that's being required of folks.
Oh yeah, it's an unbelievable difference.
It's great.
400 a month to 40.
Fantastic. Anyone? We'll open up to the entire section So I'll just, Councilmember Smith.
Thank you so much. I want to tell you guys, thank you for the hard work you do, and thank you for the support that you give to our community every day. I can't even imagine how difficult it is to be an operator on the other end. I had an emergency the other night. I was driving down Clinton Avenue, and there was a bush on fire. And I called 911, and I didn't know how to express it because the bush it got bigger and bigger by the time I pushed one. And I didn't know how to, calm myself down. But the operator was so calm and was able to, get out what it was I was trying to say. And before I knew it, shout out to the Clinton and Coleman fire station, because they were there within 2 or 3 minutes. So I want to tell you guys, thank you so much for that. I do have a question. I wanted to know, just a second, got my questions right here. So how are we preparing our operators to respond to increasing mental health calls, homelessness-related concerns, youth crisis, and trauma-related incidences?
Well, our operators are, they're very trained in that type of situation, and we have a lot more options for them now than we had when I first started here 7.5 years ago. And I think that because there's more options for those individuals, it helps us provide a better level of service, getting the proper people there that are needed.
President Melendez.
Yes, thank you. And Director Soretto, thanks for all your leadership in getting those numbers down in terms of the amount of vacancies. I know it takes a team, and your entire team has been supporting you, but certainly it takes leadership as well. When it comes to the New York Helps program, it's my understanding that will expire coming up, and do you foresee that to be a challenge for the department?
Yes, we were concerned about that, but we were notified at the end of last week that it's going to be extended till June of 28, which is going to be good for us because we have an old test that's from the 80s that really needs to be updated, and this is going to give us some time to get that test updated to where it needs to be. I think using a 50-year-old list is not something that we would want to do. So this gives us a little more opportunities to hit the ground running there in 28.
And I also want to just mention, just because I've seen ECD out in the community everywhere recruiting, job fairs. I mean, you name it, I've seen ECD in different places. In terms of the turnover issue, you mentioned that it dropped from 19% turnover in 2023 down to only 8% now. What are some of the retention strategies that you've deployed? I think staffing up helps because people have less overtime, but are there other strategies that are in place?
We have reinvigorated our employee recognition program. We do monthly awards. We do that. I think that's been really well received. Winners get parking spaces up front. They get their picture on the board. We put a nice, if you come over there, you get a nice tour. We put up a nice awards board that's really shows them how much we feel of their job that they do. But I think that's helping. I really do think the training where we included AI in the training last year, moving forward, and it's really integrated in their training. So when they hit the floor, instead of being completely cold and never have answered a call, they've answered maybe 400 or 500 calls on the simulators. So when they get to the floor, they have their script down. They're a little more confident. And it used to take like a whole, first round of training to get somebody so they're a little bit comfortable answering the phone. They hit the ground kind of with that now, so it's really shortening the process to get them trained. And when they are trained, I think they're more confident.
That's great. And council had an opportunity to be trained on 311 Live and all the different things you can do online with the system. in the budget, there's a planned mobile application. Can you talk a little bit about that and what that might look like in timeline?
Yes, I can. We're very excited about it. We were hoping to get it a little earlier, but we had some delay with Apple. But we feel like it's going to be implemented in the first quarter. We're going to roll it out in coordination with the city communications department so we can get it out to everybody. But it's going to be a way more efficient way, way easier way for people to request jobs. You're going to be able to request the 10 most sought after things at the 911 center right now, or at the 311 center. So I can provide you that list of what they will be.
Great.
It'll be available on Apple. It'll be available on Google. And I think that it's really going to be a home run for our citizens, the community. The community, people use their phones for almost everything.
Yep.
And I think it's going to be tremendous for them. And then it'll also free up people that, when they're not calling for that, people that are using the app, it'll free up our operators to spend a little more time with people that might need more time.
That's great. I'm excited for that. I think, and I'll follow up with comms on this, but the more we can do on the phones with mobile applications, not just for 301 related stuff, but even online with other pieces of our website, I think we should be trying to migrate that way. So my last thought, anyway, is that I feel like we've as a city been able to make the services of the city a lot more accessible, and I think that is because of the leadership in both 311 and some of our other departments, trying to find ways to make the pathways to getting city services easier. So I just want to commend you all for the work that you're doing. Thank you.
Thank you, sir.
Just a quick follow up on the app question. So one of the concerns, Director Sutter, we've talked about it in the past too, is there are times where people call 311, they log, they ask for a job to get done, and then there's closure to it that says the job has been completed, but the job has not been completed. And obviously that's all stuff that everyone's working through and trying their best to coordinate. How will the app work in that case? So if someone requests a job for XYZ to happen, the app says it's closed, but the citizen or resident says that it's not closed, will there be a kind of triage process there?
You mean when they're checking on it after they've entered it?
Yeah.
Well, I think we're going to have a process for that. I think we're constantly working on that to find out, because we did come across something this summer, this winter, where jobs were getting closed and they shouldn't have been.
Right.
It was a hack in the system somehow that we were able to uncover and we corrected. But we're always looking at that. If we get feedback from citizens that that's occurring, we'll definitely look into why that's happening and try to correct it, because they really only should be closed if the job has been completed.
Will the app have like a chat function as well?
There's no plans for that right now.
Okay, so if someone requests, let's just say a refuse pickup, and the app says that it's closed, but the person can see. Maybe they requested 123 Main Street, and the truck went to 232 Main Street or something like that, right? So they see that it wasn't closed. There will be some kind of process via the app to state, hey, I still need this job to be reopened.
Yeah, I think if it's closed and it's not supposed to be closed, they'll still be able to put the request in, and then we've been working very closely with DES to provide them daily updates of what's out there, it's still open, and what's closed and shouldn't be closed. So we're working through that process. I think we've increased the interaction between the two departments to try to clear up those.
Great. Thanks. And I would just, and I'm sure President Melendez has already alluded to this, but when you do roll out the app with the city comms department, if there's anything that council members can do to be helpful, I'm sure we'd all like to. And obviously from a constituent services perspective, all of us want to really master how the app works.
Well, when we coordinate with the Communications Bureau, we'll make sure they push it out to you City Council, so you can push it out to your constituents, because I think it's going to be provide a way easier access to services. I mean, all of us have made phone calls, and you found out you can do it on your app. You just go to your app and do it. So a lot of times, that's going to happen because we're going to be if people are waiting on hold for an operator, we're going to be advising them on that while they're waiting to you have other angles to request this service on the portal, and then when the app goes out on the app.
Thanks. Councilmember Leslie Smith.
Well, I just want to echo the sentiments of my colleagues and thank you all for your service to the city of Rochester, your hard work. I have a couple of questions around the CALIA. Well, actually, one question around the CALIA accreditation. Can you explain to me what that accreditation is? It shows up on page 4.
Yeah, it's the Commission on Accreditation for Law Enforcement Agencies. It was designed originally for that, but then it incorporates the dispatch function of those operations. And in New York State, it's my understanding it's just us and Onondaga County are the only ones that have been accredited by them. We have been accredited since 1998. It's a very tedious process where they'll do online. We get tested online, then we get tested on site, and it's months and months that this process goes. So last time we were accredited was in 24 on site by CALIA last year, and then we also get accredited by the New York State Sheriff's Association. But I think most centers get that accreditation. We have an on-site in 2026 for that, and I don't see any issue with us getting accredited this time. We have very good procedures. We have very good personnel. We're constantly updating the procedures. I mean, when you deal with the departments and the agencies that we deal with, there's constant upgrades to how they want to do things. Obviously, every department is doing reviews on how to better do their job, and that affects us all the time. So we're constantly updating that stuff. But I think that's what leaves us a good core. So we can't slip into a territory where I don't think you'd want to be at, and I know I don't want to be at.
Great, thank you for that. Around closing the gap, and kudos to you all for doing that. I would imagine that city residency is a requirement to work in emergency services. Were you obligated to maybe waive that residency requirement in order to close that gap?
We don't have that requirement here because it's a countywide operation. It's funded by the county, our positions, but we do a lot of concentration in the city. We have a summer internship program that's not paid for by the county. That we're on our third or fourth year, and I think it's a good program to get young people in, get an understanding of what we do, how we coordinate with other departments, and whether they decide to work at the 911 center or decide to work somewhere else. I think it's a good experience for them. We also work with Hillside to provide life skills as part of our training there, and that and all our outreach.
Thank you. And maybe this is a question for Suzanne, and it's probably in the budget book somewhere, but if you can provide the breakdown of the resources that's provided by the county to help cover this, what percentage is covered by them versus the city?
Sure. It is in the summary section under other revenue, intergovernmental other, and I can point it out to you.
Thank you. A couple more questions. You mentioned that when the app is going to be rolled out, what does the education to the community looks like in the rollout?
That hasn't been completely put together yet, but when it does, I'd be happy to provide it to the Public Safety Committee.
Okay, great. Thank you. And then who is going to, of the FTEs that you have here, manage the app? Is there a full-time position or positions that's designated to answering all of those or responding?
Yes, Timothy Keller.
Okay, got it. And then lastly, I understand from our 311 training that we as city council members, when we are inputting into the app, we have to use a personal email. Is there opportunity to change that? Because I'm still not really clear how it will get priority if it's inputted by a city council member with a Gmail account, an example.
I think that's something that been determined by the IT department. I don't really have control over that.
Okay.
We can follow up with IT.
Okay. I'll follow up with IT. Thank you.
Councilmember Martin.
Thank you all for all the important work you do and how responsive you are to our community. My first question is around the customers. You list external and internal customers, and I noticed that the action team isn't listed as an internal customer, but Pick and Fit are. Could you say more about the connection between your department and deploying the action team?
I'm sorry, I couldn't really hear what you said.
I'm sorry. Is this better?
Yes.
Sorry about that. Could you talk a bit about the connection between your department and the action team? I'm mentioning it because I noticed that they were not listed as an internal customer.
Yeah. So we have worked closely with that program since the very beginning. We are in a position that when the approval is given to roll it out, we'll be in a position to fully provide the request they have from our department.
Okay, so right now, when people call 911, your department can't make the decision to deploy the action team. There's a different process. Okay, that's helpful.
Yeah, we're in the middle of some back and forth on that. So we're using the action team to do outreach for homeless stuff and some other things. But hopefully after our conversations that we're having are over, we'll be able to fully integrate them into the process, similar to what we do with PIC.
Yeah, that's really helpful. Thank you. I also want to just commend you all on one of your key performance indicators. It says the average ring time is only 6 seconds, which is really important and significant. So thank you for that. And my last question is around how the operation cost per call is calculated.
The operation cost per call is calculated by dividing the 911 cost by the total number of calls. And similar for 311, you take the 311 budget and divide it by the total number of calls they receive.
That's helpful. And the number is higher, it's projected to be higher based on a higher cost to run the department?
Yes.
Awesome. Thank you.
Councilmember Monroe.
I want to thank everyone as well with the 911 team. I certainly have used you a lot for all kinds of things, gunshots fired and things like that. And I'm always encouraging residents to call 911. Sometimes people feel that they have to have somebody, bleeding in front of them to call 911. But for people to report if they hear shots fired, and even if they have some suspicious activity around their house, drug houses, whatever, 911 is the place to call. And I appreciate all the work that you all do in gathering information for those kinds of things, too, that help feed longer-term abilities to track how the city is doing. As regards 311, I know certainly moving to a mobile app will be excellent, but for instance, when I'm using 311, oftentimes it'll be hands-free in my car. So being able to do the, still call in is an important piece of it, as well, of course, for, people who might not be as savvy with mobile or online submissions. And also, yes, if you have a City of Rochester email account, you can't sign up with that. And I think, as you're working with IT, that can be that much more important, because one would hope that City of Rochester employees are a little bit more aware and thinking of the types of violations that are out there, and the ability to have them be able to just put the information right in, and maybe we can even follow and track and see how our employees are able to use 311 would be excellent. So thank you again for all of your work. And again, 911, you do a fabulous job. So thank you.
Thank you very much.
Any further questions from council members? I have one final question. Oh, VP Harris, do you have any questions for 311 and 911? Thank you. You're welcome. So yesterday we had a conversation with IT about their AI policy and the departments they're working with. In the ECM response to some of our questions, there was some mention of piloting some AI work, which I think makes a lot of sense. I'm sure a lot of cities are looking at this. IT talked only about fire and law, if I recall, as places they're working. So is there coordination between ECM and IT on this software?
There is, to a point, because this is all county software it operates under. So we're in coordination with the county IT department. It has to pass stringent standards to make sure that our data is not outside of this project. So we've passed it passes all the cybersecurity questions. It passed the all the requirements that the county IT department put on it. We work very closely with them before we can attach anything to the system. They have complete sign off of it. It's not like we can just sign off on something and put it in there. And when we say that we're doing a pilot, like a pilot for us is we piloted as part of the contract, we piloted the training for the trainees, the simulated calls. Another pilot we just finished up on was a pilot where the AI system listens in the background while a telecommunicator is taking a call, and it provides them prompts, important prompts that they should be aware of because of the nature of that call. And on top of that, it will also notify supervisors automatically regarding certain types of calls. Say if an example would be this one everyone can understand is that our operator is on a phone call and they're giving CPR instructions to someone that's on the phone. They would have to manually make a keystroke to notify a supervisor that they have one so they can come down to monitor. The system will automatically make that notification. It saves stress off the operator and it increases time that the supervisor get down into the phone area to assist on that type of call. It's also the same we have it set up right now for working fires, structure fire, shooting, stabbing, those type of calls. So that pilot went good. We did for 2 months, over 30,000 calls. That was extremely well received by the staff. They found it very useful. It's just part of this contract. It's not costing us any more money. It's just what we're getting out of it. We're just trying to get more and more out of the service that we're getting.
Thanks. And in terms of the kind of the way that it's standardized from an IT operations perspective, ECM defers to county IT for those kind of protocols simply because it's county-wide, which is why city IT is not really very high on their radar.
That particular AI program, yes. Any one that we might be looking at down the road that affects city stuff, then the city has to sign off on it.
Okay.
It's not something that we can just put on our system without following that procedure. There's stringent controls on that environment. Obviously, we don't want our information getting pumped into the general chat GPT function.
Right.
Everyone's using it. So no, that's not the case.
And just last question on this. So in terms of the AI pilot work that's been done right now, your belief is that the county software that you're using is the kind of path forward to keep kind of growing this a bit. It's not finding new software or anything like that. It's working within what you have.
It's working with what we have. Yes, for the operation at the 911 center when it comes to the systems that the county has.
Okay, thanks. Councilmember Lubian.
Hi. Thanks for everything you guys do. I was wondering if you could provide the number of calls broken down by the buckets that you put them in with the average response time.
I'll look at that data, but I think the response times are from the departments will have their own individual response time.
I'm thinking more of like time. Do you are you able to track time from when call comes in to when it's picked up?
You mean when somebody calls?
Yep.
And how long it takes between that call and us to answer it?
Yep.
We average 6 seconds.
Would you be able to do that? Well, I guess it doesn't matter by call type then, if it's only 6 seconds.
By call type.
Okay. So then if you could just provide the total number of calls by the different types.
I'm sorry, I'm a bit confused there.
So the total number of 911 calls broken down by the buckets that you categorize them in.
Well, we can individual calls we can look at, but it would be tremendous to try to track every single call. I don't think there's a thing in place that could break it up into that category.
So our system doesn't track what type of call it is that comes in?
It tracks by the job.
Right.
So I'm asking what you want me to look up. If you give me a job, I can provide that information. But if you want me to look at every single job, it would be a...
So you don't have the ability to track in aggregate the types of calls that are coming in to 911? Like whether it's family trouble or,
Yeah, we do.
Okay.
But if you wanted those times, we're going to have to manually look them up.
No, what I'm saying is I understand that the timing is maybe not relevant in that case because when you're picking it up, you don't know what kind of call it's going to be.
Yes.
But could you get me the total number of calls that come in?
Yeah. Oh, yeah, I can get you that.
Yeah, thank you.
Yep. Sorry, I was confused a little bit.
Okay. Thank you all for not just joining us today, but sharing the great news about recruitment and staffing. And we will take a 10-minute break and come back for dries at 10:30. Thank you.
Thank you all.
Okay, we're gonna get started in just a minute. All right, welcome back. Commissioner Green, Deputy Commissioner Fletcher, thank you both for joining us. I will turn it to you to make any introductory remarks and to introduce your team.
Good morning, council members. RISE is proud to be here today. I'll introduce our team. Next to me, I have Deputy Commissioner Sarah Fletcher, and then we have Stacy Papadopoulos, the Director of Animal Services, Christina from Budget, Highlandthaler, Sarah Scott, the Director of Camps, Programs, and Park Stewardship. Then we have Sarah Hooper, who is our Project Manager. Next to Sarah is Eric Rose, the Director of Athletics and Aquatics. Then we have Kiara Warren, who is our Senior Budget Analyst in the Department of Recreation and Human Services. We have Jim Farr, the Director of the Public Market. And soon to be joining us is Isaac Bliss, the Director of Youth Employment and Programming, and Kendra Hale, who is the Director of Recreation. They will be joining us shortly. And so I will turn it over to you, Councilmember Gruber.
Thanks. So the DRISE, it's unfortunate we can never think of another way to pronounce the new name of the department, but the DRISE department is broken up into 3 sections. So we have Commissioner's Office, which includes the administration, animal services, and the markets. And that will go from pages 3 to 8. So let's stick there. Then we'll do recreation and youth services, and then we'll close up with human services. So let's stick with the commissioner's office, page 3 to 8. I'll turn it over to any council member with questions. Councilmember Lupien.
Yeah, good morning. With programs being reconfigured, how can we ensure our ability to compare year to year for the different programs?
So when you say our programs are being reconfigured, we're not reconfiguring programs in the Department of Recreation and Human Services.
Okay.
Unless I'm missing your specific question.
Well, it's one of our suggested questions. So it's
probably in relation to Rec on the Move, maybe, but we'll get there.
I know it's probably more so just some of the staffing changes that we might have reconfigured. I think that's what they're trying to ask.
So we've made adjustments to move staff around to enhance some of our programming. I heard someone mention Rec on the Move. So for an example, Rec on the Move, the mobile recreation specialist position is moving into the Nature Center. And so we're looking at being creative that we will still be a mobile rec specialist team, but it will not be operating the way it has in the past. We're focused more on nature and our outdoor Bill of Rights, but we will be able to be in the community for some events. It won't be as flexible as we've had in the past with Rec on the Move, where we're in almost every event that happens across the city. We're going to focus on some of the major events that we'll support.
Okay, so it'll be more potentially in terms of people served. We'd like to think if it's a major event, we'll get more kids than opposed to the strategy of being at more smaller events.
Yes, and so we don't plan that we'll have less young people or families at events. It's just going to look a little different than us creating the Rec on the Move with all the programs and activities that we would do there. So if you think about an event such as, and I'll use Aberdeen Square Fair, because we generally would be there, but there's already other agencies there that's providing activities for kids. So it's not going to decrease what kids have access to.
Okay. And when you do go out, are you bringing more of a nature component to the activities?
Yes.
Can you describe what that might look like?
I'm going to ask Sarah Scott.
Can we hold off on the rec questions till we get to the rec section? Can we, because there's probably a lot more to say about the Maplewood Nature Center, et cetera. Can we focus on just animal services and markets for this section?
I'm happy to do that, but I think since we're here, can she just answer the question, then we can move on?
So we can. I'm sure there's going to be a lot of questions
There,
about the
there,
Nature Center.
there will be, which is why I'd like to just, I'll hold them, Commissioner Green.
Yes.
Thank you very much. And we'll just focus on animal services and markets for right now, and then we can move over to rec next. Councilmember Leslie Smith.
Well, I'm glad to see that, well, at least it appears that the budget overall has not been decreased significantly, actually. Increased just a little bit with decreases to animal services. We've had some concerns recently, with animal services, and I'm just curious how this decrease in budget is going to impact that department overall.
So one of the areas that you will see the decreases across the entire department is in materials and supplies. And so, as I mentioned yesterday, that's something we looked at for efficiencies. But our decreases are not impacting programming.
President Melendez.
Yes, thank you. So I know recently we approved funding for spay and neuter services and animal services that we projected to take us through about December or so. That also ends in the budget. So what is the plan, hypothetically speaking, because we're approving a budget for a year, for spay and neuter services beyond December?
I'm going to ask Stacy to answer that, but I will say that the money that you guys allocated to us was to help us get caught up on those spay and neuters that we had not done in the absence of having a vet. What we're doing now, and Stacy will speak more to it, is before animals are adopted out, we're taking care of that before they even leave the shelter. But Stacy, you want to add to that, please?
Yeah, so there were a couple things that council recently passed. One was our grant, which was moving from one vendor to another, and that grant was to provide spay-neuter services for those historic spay-neuters, those historic adoptions that did not get altered before they left. So that those adoptions were up until January of 25. So since then, everything has been done in-house. The other piece of legislature that went through council was our REVS contract. So REVS is the emergency clinic that we use when we don't have a vet on staff, so usually after hours or on the weekends. So if we have a hit by car or a dire wildlife situation, those animals will go to REVS for treatment until they can get brought back to the shelter when we do have our doctor in-house. So those were the two pieces that recently came through council that don't necessarily address spay-neuter in-house because we kind of have that figured out, but those were kind of external things that were happening.
Great, thank you. And in terms of in the budget book, it talks about expanding venues for services, right? So obviously not everything happens at the shelter. There's food distributions, there's other clinics that are happening in community, and it references identifying new locations or neighborhoods. Can you talk more about what that might look like in the coming year? What other locations you might? I know that there's been some at the sports complex, but just interested in understanding where else we might be.
Yeah, so we do almost exclusive food distributions through the sports complex, and I think that we are running into kind of pigeonholing ourselves into serving the same community members, because those community members that don't drive can't get there. And it's hard for them to find a ride there. So I think we need to start looking at expanding that particular service, not to mention our vaccine clinics. But I think we start with food distribution, because I do think we're missing families who can't get there. So we do have the ability to pull our current data by zip code to see what families we are serving and what zip codes, so that we can start expanding. The caveat to that, though, is that our outreach coordinator will be out on maternity leave beginning the end of July. So although we thought that we were going to start moving on this over the summer, it looks like we're going to have to push that back just because she'll be out.
Okay. And this is a question that may not be able to be answered today, but maybe we can talk more about this, or a response in writing at some point. Councilmember Monroe and I actually have been meeting with some folks around what other alternatives exist in other cities for ancillary services like spay and neuter, and other types of services. And what's come up is there's a lot of entities that or other cities that farm out some of those services to other partners, and they just have specialized services that are outside of the shelter system, but that coordinate with cities. And I'm wondering if we've looked at things like that. The one that comes up is Emancipet in Austin, Texas, I think it is, which is an external spay and neuter clinic that offers a bunch of other services. And I just wonder if there's an appetite for us to start looking at how we might attract other animal services related partners. I know we have Lollipop, but to do more work in the city of Rochester, and whether or not that's something that's come up in animal services discussions.
There is absolutely an appetite for that. We had the first Emancipet was actually in Philly, and when it was built, they partnered with the shelter I was at. So I do know Emancipet quite well. There is absolutely an appetite to start finding more vendors. I think the problem right now is financial. We just don't have the budget to meet the financial requirements that these outside practices are expecting to provide this service. But Revs is a really good example of us utilizing outside services, where that grant money is moving from Revs into Rochester Community Animal Clinic. That's another really good example of an outside provider doing our spay neuters. So the more vendors we have, obviously the more alters we can get done. But right now there's a financial constraint. We just don't have the funding to meet that financial requirement.
Got it. Thank you. And have to ask, we're here. Vet, what's going on?
So we have a contract with an agency to do recruitment. Just recently, Stacy shared an article with me that this is a nationwide issue, and just something we just continue to try to find a vet. It is not because of lack of trying. We got a candidate recently that Stacy was able to look at, but did not meet the qualifications we need for a shelter vet. But we will continue to work with the agency, the recruiter, to see what we can get. But I will say, in the meantime, it's always about what are you going to do while you don't have. We have contracts with several vets that are coming into the shelter to work with Stacy's team, as well as she mentioned, some other outside agencies that's supporting the work.
Great. I want to thank you all for the work you're doing.
Can you give a quick update on the sea shed at the public market, where we are in the process?
Thanks. Yes. Right now they're just about at the 95% point on construction drawings for that. So very soon we'll have a shovel-ready project.
And just to confirm, we've obviously paid for the construction drawings, and we have some money for the construction, but not all of it. Is that right?
Yes, we have $2.8 million, and depending on how it's phased or whatever, we need anywhere from 11 to 19 million. So we have a ways to go.
Okay, thank you.
The design is going to come to us in phases, but different than what we originally were going to do. because we have a better chance of rolling them out in phases as money is available.
Great. Thanks. Vice President Harris.
Thank you, Chair Gruber. Commissioner Green, thank you very much, you and your team, for all the work you guys have been doing to provide support to our animals in the city. I know that it's been challenging coming out of COVID, and now it looks like things are much brighter with your team as you added to your ranks. So I have a question. I see on page 7, it talks about the several key performance indicators that have been removed as the city website now features a live dashboard provided by Shelter Animals Count. Can you talk more about that live dashboard?
So Stacy has been working on having a dashboard that provides better data than what we were capturing in our KPIs. And so that dashboard is available on, I believe it's on our website, Stacy?
Yes, it's on the landing page for RAS on the city's website.
And so you can see a lot more data, which also compares us to national average.
So is that data board in real time, or is that updated like periodically?
Real time.
Oh, okay.
Yes, monthly.
Oh,
the numbers
monthly? Okay. That's helpful. So I look at that, and I do have a question. And I think I've asked this before in years past. I noticed that the Lollipop Farm, and I'm not comparing us to them because we've had different challenges in the Lollipop Farm, but they take advantage of their youth in their community. They have volunteer opportunities. And I brought this up before, and at the time when I brought it up, we were not prepared because we had, we were coming out of COVID and everything. So I'd like you to strongly consider creating a volunteer opportunity for our teens in our community. Why is that important? It's important because I've been working with the school district for a few years now, and I often hear from kids, young kids from 12 to even 18, I want to be a veterinarian. I want to be a veterinarian, or I want to be a vet tech. And these could be your future advocates. These could be your future veterinarian that we could be raising up right here in our own community. I know the benefits of this possible opportunity is that it also can be a direct way that we can increase better animal welfare in our community. When kids are very well versed in learning about animals and, at a very young age being an advocate, then they too become an advocate in their neighborhood. And, and they often end up being the ones that rescue pets in their neighborhood too. So just something to think about. I see that Lollipop Farm, they have a few categories. They have shelter helpers from ages 8 to 16. They have a teen club, 14 to 17, and youth foster programs. I do know that this is all volunteer. I mean, you guys are pretty much RAS. There's a volunteer sector, but, there's got to be a way that we can kind of find a way that we can engage our teens using our own space and our own methods, but that's perfect to the city.
Thank you. We'll look into that.
Thank you.
Councilmember Smith, followed by Councilmember Leslie Smith.
I have a couple of.
Sorry, Councilmember Smith. First.
Sorry, wrong Smith.
Thank you so much, Stacy, for the work Dr. Green and the entire department. I had the opportunity to visit our animal shelter, and as a dog mom, I don't have children, but I have dogders. It means a lot when you meet people who really care for animals the same way you do, and it's evident in our animal services department when you walk in there, from the director down to the individuals who volunteer. They really understand the animals. They understand and care, and for that I'm very appreciative. So I wanted to say that, but I do have a quick question, and I wanted to know, residents sometimes report like delayed responses, and I'm not sure because I feel like we had this conversation, but you can clarify for me on the record. Residents sometimes report like delayed response times regarding like stray animals. dangerous dog situations, or just neglect in general. Are current staffing and operational resources sufficient to meet the community needs and expectations around like stray animals or neglected pets? You know, we've had a big issue over the last couple of months. I'm just curious where we are around that with this budget.
Animal control officers are dispatched through our 911 center. I believe we have one vacancy in that position as of recently. In terms of the delays, Stacy, I don't know if there's anything you would like to say about potential delays.
Generally, there aren't any delays. I think a lot of what the public is saying is that we're not responding, but some of these calls are not our calls. If it is suspect cruelty or neglect, we do not have the jurisdiction to enforce that. We have to defer that call to either Lollipops Humane Law Enforcement or to RPD. So the delay in response isn't necessarily that we haven't responded, it's that we can't do anything with the situation. We simply do not have the jurisdiction to respond to the particular situation that we're presented with when we get on site.
And I think that's really good clarification for the public to know that that's not something that we have control over. So to be clear about what that is helpful. Also, maybe you can clarify as well, a lot of residents have been complaining about the irresponsible overbreeding, in particular around pit bulls. How is the city addressing irresponsible breeding practices, including promoting spay-neuter efforts and preventing animal neglect before situations like that escalate? So the overbreeding of pit bulls, which I know, Stacy, you and I have had conversations that it's not necessarily an overbreeding, I think you clarified, but it's just the concentration of the environment that we're in. But is there any way that this budget addresses any of those issues? Or maybe that's a clarification for another time.
This budget isn't going to address it because this budget is still kind of cleaning up those historic spay neuters. So that grant that is carrying through into the next fiscal year is still a voucher program that is designed for those historic adoption spay neuters. Moving forward, we could apply for this same grant for a voucher program, which would then give vouchers to the community at large. So no qualifiers, we can just hand out vouchers so that the public can get their already owned animals altered. The problem with the voucher system is that we need to find a vendor to provide that service, and that's kind of where our hang-up is. So we could have the vouchers, we could have people willing and ready to utilize the voucher system, but we have to find a vendor to provide those services, and that's kind of where we're getting hung up right now.
And I also want to thank you guys for providing the free, services to both animals and dogs throughout the city. I think that makes a major difference, in particular for families who may not be able to afford to send their pets to the vet. So thank you guys for that service. My last question is in regards to the public market. I want to thank you guys for doing such a great job at the public market. I'm not sure if it's called the matching coin program. I'm not sure, but I hear people in community talk about it all the time, about especially during the last few months. Families were elated talking about this program. So I wanted to know, how is this budget continuing to support or expand the matching coin program, and what measurable impact has the program had on food insecurity, healthy food access, and neighborhood families? If you have that, you can give it to me in writing. I'm okay with that.
Can we get that to you in writing?
Not a problem. Thank you so much.
Councilmember Leslie Smith.
Yes, I also have some questions regarding the public market. For one, I love the public market. My favorite is Flower Days. I love Flower Days. I also love all the food truck rodeos. One of the things that we mentioned I mentioned to communications recently was just if there could be an effort in the promotion of whatever RFPs for bands at the public market, if we could consider a more diverse group of bands. None of the bands that are going to be at the food truck rodeos this particular season are reflective of me, my family members, etc. So I am hoping that there could be a real concerted effort to do that. We also have, we have so many local bands here that go across a very diverse spectrum. So if we could be very intentional about that, I would really appreciate it.
We certainly will look into that. Thank you.
Councilwoman Monroe.
As far as the public market goes, I want to thank Jim Farr for many, many years of service, and it has just been a jewel for the city for so long. And it's just such a huge asset for people coming from all over gathering, as well as having a much more affordable fresh food. So thank you for your work. I was very happy to learn that now we're able to do the spay and neuter before we adopt out animals. And I have, I want to kind of uplift Vice President Harris's comments about, for the future, thinking about educational components about how we can better interact with our youth. And I don't know if that would be certain little camps or things that could be run through recreation or something creative like that, just so that we start to get the messages out there about the proper care for animals. Because as we know, people will repeat the same things they're learning in their own home. So the more knowledge that we give our kids, the greater chance we have for things changing. And of course, just like with recycling programs, a kid starts to learn about recycling, and next thing they go home and they're bugging their parents to make sure that they wash out that plastic and start doing recycling. So I think that would be a great addition. I know that, we have a kind of a bare bones budget here, but just an idea. I know that we're now chipping, or we have been chipping all our animals. What is done with that data? Like, in what ways do you use that?
The animals at RAS have been chipped for over 10 years. Every animal that has been adopted for the last at least 10 years has been chipped before it left. It's probably longer than 10 years, but I can only see 10 years of data. I'm not sure what you mean by how are we utilizing that data? Can you clarify that?
I'm thinking about dogs that might frequently make their way back to the shelter because they're not being properly, fenced or taken care of, that they get out loose a lot.
Yeah, so if we have a chipped animal that has made multiple visits to the shelter, and sometimes we don't know that just by chips, sometimes we know by license, or sometimes we know by who comes in to reclaim that dog, by their ID, the reclaim fee increases so that there is a more incentive to ensure that this does not happen again. And with every reclaim, there is counseling. How did this dog get out? How can we prevent it? Is it altered? Is that how it's getting out? Do you need a fence repair? Is that how it's getting out? So there is counseling that happens every time an animal comes into the shelter, but especially for those who are what we call repeat offenders.
And if I'm correct, now are we able to do a certain amount of vetting of potential adoptees so they have a better idea about what animal care is and what might be, certainly for dogs, what might be the best matches for them in their household?
So again, the counseling process had always happened at RIS. I think we have fine-tuned it over the last 2 years. We want to have open adoptions. We don't want to immediately tell anybody no for whatever reason we think someone should not have an animal. What we need to do is have open conversations with people, understand what their needs are in their household, how their household is set up, and what kind of animal best fits in that household.
Can you provide written policy or description of animal control officer duties, and then how that overlaps or works with both the Humane Society and RPD?
Get that to you in writing.
My other question is, could you provide the number of dogs and cats that are euthanized, and then also provide that same data as a percentage of all the dogs and cats that are taken into the shelter?
We'll get that to you.
And that data is on our new dashboard. So you can see that data in real time, month by month. All of that data, including euthanasia, is on the dashboard.
So is it kind of the same as far as dogs? It was 1,000 or 2,000 annually that we end up euthanizing?
Absolutely not. That number is very high. I did provide earlier, Dr. Green may have provided it. In 2025, we have a live release rate of just about 87%, which is just a few hundred animals. So I can pull that exact data, but that data is available on the dashboard. You can see 3 years of data on that dashboard, and it will give you real numbers, including euthanasia numbers.
Oh, that's great. And then that answers my question about what the live release rate references. Something I've always been curious about is how Friends of Verona Street works with RAS, and I was wondering if you could discuss that now or provide it in writing.
So Friends is our nonprofit arm that directly supports the shelter. So there are a lot of things that if I had to do through the city would take way longer than we need it to take because these are live animals in our care. So the Friends supports a lot of that. One of the most important things that the Friends provides is the staffing grants for our foster and rescue coordinator. So that position is a city position, but it is funded by the Friends group. They also provide our volunteer coordinator. So we have 180 active volunteers. And without that volunteer coordinator that is on their payroll, we would not have anyone coordinating those volunteers in an efficient way to make sure that the things that need to get done are getting done. So those are two of the biggest things that they support us on.
That's great.
Last couple of questions here, Councilmember, because we got to move to the next section pretty soon.
Sure. Just checking my notes here. I think that covers all the questions that I had. Thank you very much.
Thanks. Last question on this section from Councilmember Martin.
Thank you, Dr. Green, for all the important work you do and your entire team. I just have a quick question for Stacy. Could you point to any part of the animal services budget that was largely shaped by community discourse or input?
That was shaped
by community discourse or public input?
So I would say that our budget always includes what we hear from our community. I don't think we can point out anything specific, but we talk about the clinics. And we know that the community wants the clinics, both the vaccine clinics as well as the food pantry. And so we make sure we have money in our budget for that. We know that the community talked about staffing a few years ago. And so we were able to make some adjustments to staffing to support some of that information. We know that we hear often about we need a vet, we need a vet. We have the funding for a vet. It's a matter of when we get a vet. And so I think within the budget, everything that we do brings into what we've heard from our community. But to say where it is specifically is throughout.
That's helpful. Thank you. You did point to some specific examples, I will say. Thank you.
Okay, we'll move on to the Recreation Youth Services section. So this is page 9 through 15. And we'll start with where Councilmember Lupien had left off, and maybe just ask for a larger overview on the Maplewood Nature Center staffing and how it ultimately is impacting Rec on the Move collectively.
Okay. So as you know, we're opening up the Nature Center, and we are going live for our first program, summer camp. But I want to be clear before I turn it over to Sarah that we're building it along the way. So as you will see, things will shift over the course of the first year. We are working and partnering with school districts to ensure that we have young people in the space during the day, as well as having after-school programming and evening and Saturday programming. So we are building that as we go, but I'll let Sarah, if you want to speak to some specifics.
Sure, just to be clear, you want just a general overview of the vision for the Nature Center, or are there specific questions related to programs or staffing?
Well, I have some specific questions. Let me start with Councilmember Lupien to ask any questions that you want to start with specifically.
Well, my question was around the programming for Rec on the Move, how you would be incorporating nature.
Sarah, you can answer
Yep.
that, please.
So several years ago, the city adopted the Children's Outdoor Bill of Rights, which lists out several key experiences that we believe all youth in the city should have. And so we've been incorporating that into our programming through our Earth Explorers program, through Rec on the Move, and through any ways that our staff come in contact with the public, whether it be in a park setting or in a recreational setting. So the vision is, and again, this is a work in progress, so the vision would be to make sure that all of the programming that my team under programs and stewardship are incorporating those outdoor Bill of Rights tenets into the programming. So when we have a group visit the Nature Center, or we're going out to an event and providing some kind of tabling or engagement opportunity, we're tailoring those experiences more towards connections with nature, some kind of STEM exposure, which is sort of the model of what Rec on the Move was doing. There was a steam engine component. We also started to incorporate the Children's Outdoor Bill of Rights into a lot of the programming we were doing out in the community. And so I think it still touches on that park stewardship component.
Councilmember Lupien, your follow-up questions?
Not on that. Thank you for that. I was curious about the social emotional supports within the rec centers and how that's been going, and how you see it proceeding in the future.
We've shared some data at one of our, I believe when we did our work session, but we can share updated data that we have gathered from our partnership with Center for Youth. As you know, the SEL started as part of ARPA dollars. Those fundings end in December. So what we've done is we've increased the opportunity for our full-time senior rec specialists to be trained around trauma-informed care, social emotional supports, and so that work will be embedded in all of our rec centers through the training that they've already gotten with Center for Youth. We will continue the training from July through December. In this budget, there's funding for us to continue training, and so that we will be able to continue the supports in all of our rec centers around social emotional learning.
Thank you. That's great to hear. And forgive me if I missed it, but do we have any data on the turnover rate of our rec center staff?
We can get that information.
That'd be great. Thank you.
So I want to ask specifically about the Nature Center and Rec on the Move from a staffing perspective. So I presume that part of the challenge here was, how do you staff appropriately for a Nature Center without knowing exactly what the demand for it was going to be, right? That's kind of what how you framed it, Commissioner. Mm-hmm. So it seems like the decision was transfer the Rec on the Move staff over to the Nature Center, let them be there and run the place when it's in use, and let them be Rec on the Move employees when there's a specific demand for Rec on the Move. Is that right?
Not exactly.
Okay.
We will not continue what we normally know as Rec on the Move.
So there will be no Rec on the Move vehicle. There will be no Rec on the Move events this summer.
There will be the Nature Center team will be at events. We are not calling it Rec on the Move, because we don't want that connotation to continue. We still have the vans that will be going out. They are being redesigned to be a part of the Nature Center.
Okay.
You won't see Rec on the Move on the vans anymore. There's going to be a new wrapping that ties to the Outdoor Bill of Rights and the Nature Center. But we will be out in the community, just in a different way.
So there will not be recreation done the same way. There'll be nature-based,
correct,
mobile programming.
Correct.
Can you share with us as a follow-up just what the new the branding and the design of the new vehicles, so we can know what they are when we see them?
Sarah, are they complete?
Communications is currently working on a design package for all of the nature-based Maplewood Nature Center COBOR programming. So when that's available, yes, we can certainly share that.
Is the hope that it's available for this summer?
Yes, absolutely.
Got it.
Yes.
Okay, so can you share big picture, what is the staffing model at the Nature Center?
Yep. Oh, sorry about that, Commissioner. Sure. So currently we have environmental educators that work for our department. They will be based at the Nature Center. The vision is to try to maintain the programming that we've been able to do. So we currently have environmental educators that do mobile programming at rec centers and some other community partners. We we plan on maintaining that in some capacity. We don't want to lose that connection directly to the rec centers. We also want to welcome rec centers and staff to the nature center. So we're hoping to have the opportunity to do field trips. We'll have staff at the nature center, a coordinator position, environmental educators that will be there, as well as part-time seasonal staff that will staff the site. So there will be registration required programming for participants to come and have a guided experience at the nature center. There will also be opportunity for the general public to drop in and do a self-guided experience at the site. So once the site is prepared and we welcome you all to come visit, you'll see that there's sort of a self-exploration, hands-on opportunity on one portion of the site, and then there's an actual program space, lab space, where we can have our educators provide guided programming. And then we are planning out a robust calendar of activities. We're trying to target all different age ranges, from youth that can attend with a parent, like let's say a toddler, for instance, up to teenagers, potentially, depending on interest, as well as adult programming. All of the programs at this point will be free to the public.
Awesome. Very exciting. Last question on this, then I'll turn it over to Councilmember Leslie Smith and look for other questions as well. So there will be open hours, but it will fall on it will not be the same hours as other rec centers. It'll be its own hours.
Yes. So this site is not a general rec facility. So we are saying that we would, at this point, 16 and under would need to be accompanied by an adult or a caregiver. The hours will be different slightly because we'll have daytime hours into the evening. We won't be open as late as a rec facility.
And when will all those hours be set for this summer?
We have a general schedule at this point. I think we're looking at 9 to 4 as the general open hours, with some evening programming depending on what we can schedule and what the interest is. We have a couple different neighborhood walks that will be leaving in the evenings. And then I believe the commissioner noted that we have our paid summer camp at the site. That will be 8:30 to 5:30. And we're looking at a 9 to 3 schedule for Saturdays. And I do want to point out that we did look at several different nature centers across the country and in some of our sister cities here in New York to see what their hours look like, what their staffing structure looks like, and we're kind of trying to model it off of those who've done this before us and have a lot more experience. And as the commissioner noted, we have a general idea. We have a lot of research that we've done, but with any program, we're going to kind of take in data, look at if people are saying that the hours need to be adjusted and staffing allows for that, we can do that as we go forward in the future.
Thank you. I'm very, very excited about seeing this come to life. It's been a long time coming, and my 6-year-old's excited to be in camp there this summer as well for a week. Councilmember Leslie Smith.
So I wanted to know, when rec centers are closed for renovations, what typically happens with young people? Are they steered in another direction? What's the process for that?
So we're referencing Lightfoot that is closing in June. And so we do several things. We share with the community in advance that it's going to be closed. Those families will be offered opportunities to go to any other recreation center. And we do realize that some families have difficulty in terms of transportation. A few years ago, we closed Lightfoot for a period of 3 weeks for certain reasons. And the team met those children and families at the rec center and drove them to a different rec center for the day. So we'll have opportunities for families to access any rec center. But if there's families that have difficulty with transportation, we'll have to work with them.
Got it. Thank you. And is questions around parks in a different section?
Sort of DES, but sort of here. This is a good time to ask them.
I'll wait till DES. You think it's a good time? Okay, great.
Yeah, I mean, they might say DES will answer it, but give it a whirl.
Okay. Well, I just want to thank you, Dr. Green, and many members of DES and other parts of the city that came to the Beechwood Neighborhood Coalition to really address some of the issues and concerns around the park in our neighborhood, which I don't know why it's escaping me. Yes, Grand Avenue Park. One of the things that was a fail forward on our behalf was, even though we were at a neighborhood association and we were hearing from residents who wanted something different, who wanted protection of that particular park, what we did not do was go and talk to the neighbors that were immediately in and around the playground, because their voices matter as well. And obviously, that's not to diminish the voices of those who were there, but I'm curious about the amount of capacity that your department, and even this will be a question I will ask the DES as well, has to do that type of outreach and community engagement, just to ensure that, because as you can imagine, there are a lot of opinions about what should happen in any particular community. So how do you dispatch your staff to do that community engagement and then sort of distill the information to come up with the final solution?
So it's important for us to work with neighborhood associations because they are the voice in the community. We don't have the capacity to be out in the community to do that work. And so, as you mentioned, we were at a community meeting, but it didn't represent the immediate community where we made the changes to. And so I think that was something that both our team and DS team, as well as the neighborhood association, talked about, that when we are making a change, although we come to a neighborhood association, how do we make sure that information is spread across the true neighborhood?
Thank you for that. And I would argue that it did represent, because there were people from Grand Avenue who were at that meeting, and there were time and time again that there was outreach from that community about the concerns at that playground. But I'm curious if in future budgets we might be able to see resources for increased capacity, because I do think that I hear the limitations that it's on your current staff right now, and also do think that the city has a responsibility to kind of hear a broader opinion about what's going on, so that we're not utilizing resources that maybe should be put somewhere else. It's a hard place to be in, trust me, I know. But I'm really appreciative that there was a solution, and just hoping that we could ensure that all voices are a part of the process in the future.
We'll continue that outreach as best as possible.
President Melendez and Councilmember Smith.
Yes, thank you. So I want to go back to Rec on the Move again. So I heard rebranding, moving away from that nomenclature, but what does rebranding entail in terms of the service that we're providing to the community? So if it's tied to the nature center, is the outreach going to be specific to recruiting people to nature center? What does that look like?
So I think Sarah mentioned that as we get data, we'll adjust the hours. When we're opening, we set hours. But we do know that as this project continues to move forward, we'll need to make adjustments. And so we have that in our plans if we need to do something. The biggest change, though, what I will say is, the biggest change that people will see with Rec on the Move is some schools, when they have their field day, they will call for Rec on the Move to come to the school and lead that event. That won't be an option with the way we've restructured. But I can also say that prior to Rec on the Move, as a former principal, we didn't use those resources either. We built those things in-house. And so the district will have to build some of that back into their own planning. The other thing is, in some of our community-wide events, and I mentioned Aberdeen Square Fair, I'll mention Juneteenth coming up, that a lot of those larger events have called for Rec on the Move come. But what we found with our data last year is there were so many other play events for kids that if we were not there, it would not have impacted the event. And so we're confident that our changes will not impact events in that kind of a way. However, if we find that someone is looking for something that is not available for them, we will work with them to try to help them. One of the things that Sarah's team is also working is creating play kits that we can give to those organizations to do the event for themselves with our material. I believe the library currently allows families to rent those now. And so we will enhance that, working with the libraries as well as Sarah's team, create play kits.
Got it. So I'm going to push back a little bit on this. So I think this is an outside assessment now. I think Rec on the Move conceptually lost its way at some point to becoming focused on events and schools and that kind of stuff. The original intent was to go to deactivated playgrounds, to go into neighborhoods where there wasn't a rec center, but there was a park, and to try to entice families in those neighborhoods to come and use their local neighborhood park. So the intention was to try to activate spaces that were not being used. And I remember probably a decade ago, maybe less time than that, Rec on the Move staff would, the week before coming to a park, would knock on every door in the neighborhood and say, next week from 3 to 6, we're going to be at Don Samuel Torres Park. And then the following week, they had a whole calendar of every park they're going to be going to, and they would spend the energy doing outreach in the community to say, we're going to be here, we want you to be here, we'll have snacks from Food Link or whatever it was. And the amount of families that would take advantage of that at the time, I think, was significant. And it sustained beyond Rec on the Move being there at the parks, because then families felt comfortable going to their neighborhood park and activating the park. So I don't know if there's maybe an opportunity to strategically revisit how we utilize Rec on the Move to ensure that we are coming up with a strategy to activate parks. But I feel like that's a missing link here that I think we could possibly reconnect.
So you're absolutely correct. The last 3 years, we have done exactly that, where we tried to activate parks. We were not getting the numbers that we probably were getting 10 years ago. And so that's why we've shifted to more of events and school events, because when they were knocking on doors, putting a calendar out, we were not getting that. But the other thing we have been doing the last few years is Pathways to Peace. They have been doing peace barbecues at some of those locations, trying to reactivate those spaces. That will continue. We will continue to do barbecues at these parks that trying to reactivate them, as you would say, to get the community to understand that these are in your neighborhood and we want you to use them. As I said before, if we get feedback that something's missing, such as what you're talking about, we will go back and look at how we can do that.
Not sure that I'm happy with that, but I hear you. I do want to pivot really quick to Summer Leap. So I know that we eliminated, it looks like, just over half a position in Summer Leap program this year. How are we involved in that program at all anymore, or what does that look like moving forward?
So the last few years, we hosted a Summer Leap in 2 of our facilities, working with Summer Leap. This year, it's not part of our budget. We had a position for an educator that we eliminated in the budget. It was vacant since, I believe, July of last year. And so that was one of the positions that we abolished in this budget. But we have been in contact with the pre-K department, the UPK Advisory Council, which I sit on, and making sure that there were still enough locations for Summer Leap this summer. We are still offering Summer Leap opportunities to come to the rec centers for the swimming program that we started with them. So those things will continue at rec, but we will not be a host site.
Got it. Okay. That's it for now. Thank you.
Councilmember Smith and Vice President Harris.
Thank you so much. I wanted to ask if you could clarify for me what the recreation hours are. I'm not sure if you're saying that summer programming will only be from 9 to 4 this summer, or are you saying 9 to 6?
So the summer hours vary at recreation centers.
Okay.
And if you look in our guide that we gave to everyone, I think last meeting, it has the specific hours. Some are open certain days of the week till 6, some till 7, some till 5. And that's all based on some data that we collected. I believe we shared some data with you all that talked about the hours and the numbers of kids and families coming to rec. And so Kendra and her team, which I will say many of them are sitting out here, the folks who actually run the recreation centers are sitting out here, but they've adjusted the hours based on the community that they sit in and the programming and services that they offer. And so it varies.
Thank you for that. Can you also clarify what public education efforts are underway to help residents better understand and access PIC services appropriately?
So we will be
Can we hold off on all PIC questions until we get to the next section?
That's in human
So
services.
this-
I'm sorry.
Just rec right now. You good?
No problems. Yep.
Okay. Vice President Harris.
Thank you. I just have a follow-up question about the Lightfoot Art Center. Is that typically a site where you provide summer meals?
Can you say that again?
The Lightfoot Art Center, is that a site that where you normally provide summer meals?
Yeah, all rec centers provide summer meals.
Okay. So what is the plan since they're closed this summer? Is there a plan to provide summer meals there still, or some kind of way, or will they be diverted someplace else?
They would be diverted someplace else because if there's no staff there, we can't serve meals there. And the building will be closed. But we also know that Rochester City School districts that have summer school sites, they also provide summer meals. I don't know where their summer school locations are, but we'll look into that area of the city to ensure that there's some places in that area that summer meals will be provided.
Absolutely. I appreciate that, Dr. Green. You're just concerned about the impact for families while that center is closed. Thank you.
Vice President Harris, also Food Think runs a mobile summer meals program, so I'll make sure to connect you with the right folks over there to talk about opportunities there.
That's perfect. Thank you.
Okay, last question on rec, or last two questions on rec, and then we'll move over. Councilmember Monroe.
Is FoodLink the vendor for our summer meals program?
No, it's the Rochester City School District.
Okay, so it's the same type of food that they have. Okay. So as we look at the Bill of Children Outdoor Bill of Rights, do we also do winter activities? I know sometimes it can be challenging to make sure that kids have all the gear that they need to be outside, but I'm wondering if we're introducing them to, winter sports and things.
We do provide winter activities as part of Outdoor Bill of Rights, and that's, Sarah mentioned her environmental educators. They're out in the winter as well.
Great. Do we do anything, or have we considered the concept of play streets? Sorry, the concept of play streets.
I'm not familiar, but I'm not sure. Sarah, is that something we're familiar with?
Yes. So I think this connects back to the questions around Rec on the Move. So I think the commissioner is correct. We were in parks. I think the most successful events that we have are when we're partnering with a community organization or a really strong neighborhood association. So I do think that going forward in this sort of hybrid model, we could look at more partnerships with community organizations in specific park locations. The Play Streets model is something that we have participated in, mostly with helping to navigate the permit process and sort of coordinating with our partners in DES and NBD. And I foresee that that's something we could continue to do if there's groups that are interested.
So in that regard, it's almost like if a a block group is deciding to get the permits to shut down their street, that then they can have perhaps the play kits or things like that, or is that what you're?
Yeah, what we've done historically is we've helped navigate the permit process so that our colleagues in special events, because the RPD and the fire department need to be made aware depending on which streets are closed, they determine if it's allowable depending on the street and how important it is to traffic in those areas. Once all those decisions are made, and again, we kind of hold hands through that process so that community members don't get caught up in the bureaucracy of all the permits and things. And then, yes, we provide that service, and then we do provide some support at the event, but really it's about the community leading those Play Streets events.
And how are we doing with our seniors? Do we have particular programs that bring in the most seniors? Do we have certain art centers that have a more active and engaged senior population?
So the data that I presented broke it down by age group and by location, so we could look at that to say that. But all of the recreation centers do host at least one senior program, adult. I'll call it an adult program. At least one adult program throughout their programming year.
Okay, but not the same. We're not having an experience where seniors are doing the drop-in type of thing. We are more oriented toward youth for just coming in and hanging out at your rec center.
I would say that where we have pools and where we have our weight rooms, you probably will see more adults at those locations as drop-in.
Okay, thank you. And I believe I have one last question. Oh, no, actually just the comment on, so looking forward to the Nature Center opening. It's very exciting and such an exciting model. And I mean, just that section there, so cool that, you know, you can be at the Nature Center, you can take the pedestrian bridge across and head down to the zoo and get more education about animals as well as the outdoors in our natural environment. The playground is beautiful and unique, and I certainly encourage people to take their kids there. It's not your standard playground, and the ribbon cutting for that was wonderful, and really kudos on the Nature Center, a huge undertaking, and I can't wait to see it all in practice. Thank you.
Councilmember Martin.
On page 14, in the sub-bureau and activity table, can you explain, I guess this is like a procedural question, the senior recreation specialists are re-bracketed, it seems like, and I guess why is it done that way on the table? Maybe it's a question for Suzanne. Like, why is it zeroed for this year, but yes.
Historically, when we re-bracket positions, we will show them going away in the current year and then pop them in at the new bracket.
Gotcha. It's just how it's done procedurally. Makes sense for you all. Okay.
I mean, because you kind of, if you want to truly show a year-to-year comparison, you need to leave what the positions were in the prior year and then see what they are now.
That's helpful. And were there any layoffs in your department as a result of budget constraints?
So there were no layoffs, but we did abolish vacant positions.
Okay. That's helpful. Thank you.
Just a couple last questions on rec, and then we'll move it over to our final piece. How are we doing on staffing at the rec centers? Generally speaking, are places fully staffed? Do you find you have the seasonal help that you need?
We are pretty much staffed. As you know, we hire a large number in the summer because of the way we schedule summer. The last time I checked, and Kendra correct me, we were almost 90% full. We had an open interview session, and we usually have a second one to make sure we fill all of those positions. I think someone asked a question about turnover. One of the things that we find that people indicate that they're coming, and then when summer programming starts, for whatever reason, they may change their mind. So you will see that as part of our turnover. But in general, we have been doing very well the last few years to fill our vacancies.
Great. And just a final comment that you've heard from me before, Commissioner, I think that the investments in the Genesee Valley tennis courts and the creation of new pickleball courts has been really beneficial across the board. I would love to see continued investments in racket sports. They're growing in popularity across every community. We talked about, we got Venus Williams coming to town for a talk later this year, so we got to make sure that we get some clinics for the kids. But I'd love to see the Cobbs Hill courts done too. The Cobbs and Genesee Valley are two incredibly well-used parks for racket sports, and there just hasn't been any significant investment in the Cobbs Hill courts in a number of years. And I think when we have the room in our budget, it's a place to prioritize. We will move over to our last section here, which is human services. So open it up to any part of the DRIVE's budget. And let me just start before I ask council members to weigh in, just for an overview on the action team. Where are we in the process? How are things going? Staffing, anything that you can share in regards to the negotiations that are happening behind the scenes right now. That will all be very helpful to know what we can know.
So the PERB hearing is continuing, but that has not stopped our work. The action team has been out in the community. I think they've had, from December to April, they had engaged with 2,000 people, not individuals, but 2,000 engagements in the community, which has been huge, a big difference from what we would have seen in the past. They are also working with neighborhood service centers on possible call types that they can focus on, which are trespassing and annoyance calls. So some of those calls go to the NSCs and our team, and I believe Christy's maybe here, that's picking up some of that work in collaboration with neighborhood service centers. So we are fully staffed. We have a team of 8 members on that team, and Christy leads that team. We've had quite a bit of turnover from when we started last September hiring for various reasons, but right now we're back at fully staffed.
So what is fully staffed?
8 members,
8
and and the manager of the team.
And every member has the same portfolio, or do different members have different areas of specialty?
Different members came with different areas of expertise, and so the teams are always 2 people in the car at a time, and so they balance each other because of the experiences that they bring. Some of them have been neighborhood change agents through AP, so that gives them a level of experience. Some of them have been on the Pathways to Peace team, so that gives them an experience. And some of them have worked in agencies where they did outreach. So we have a variety of team members.
And lastly, for me, I'll start with Councilmember Smith's question before that pick. In terms of what's happening from a negotiation perspective, so anything that's the negotiation is happening, it's at PERB right now?
Yes.
And is there a timeline that we'll know some answers?
So we don't have a timeline yet for answers, and I just want to make clear while Action is very engaged in a lot of different work activities, none of those are the work activities that are subject of the PERB action. So we don't have any calls, for example, running through ECD, but obviously Action's doing incredibly meaningful work, and quite frankly, I think this has provided us an opportunity to see what other things that Action Team resources can be doing and the impact that they have been able to have.
So in other words, the PERB, the case that PERB is seeing has nothing to do with what Action is currently doing. Depending on the ruling, it may open up more things that the Action Team can do. May.
Yes. Yep. You're right.
Got it. Okay. Thank you. Councilmember Smith, do you want to repeat the question that you had started with before?
Yeah, I wanted to be clear on if there's any education and awareness around how community can access the PIC team and the action team. If you can start with that question, and I have one clarified question for Jen and James as you're asking that.
Okay, so in terms of accessing the Action and PIC team, we have been in the community and we have flyers and brochures that we give out to communities. We go to neighborhood associations. When the Action team first started in September, they tried to go across the city to as many neighborhood center associations as possible. So that's how we've been getting the word out. In terms of PIC, PIC celebrated 5 years earlier this year, and so there was a lot of advertisement about PIC in the first few years. So we're planning this fall a town hall, sort of say, that we can reintroduce PIC to the community. Things have changed over the last 5 years. I will say that PIC has grown over the last 5 years. When I first started, even staffing was mostly part-time and on-call to we moved to a full-time model. And so we continue to enhance that. And so this fall, we will be doing a big outreach around PIC to let the community know we're still here. Here's how you can access us. And so those things will continue. On June 18th, every year, the Department of Recreation and Human Services does what we call an outreach day. And the entire department goes out into the community. Everywhere in the community, you will see DRY's members. And while we're out there, we will share our recreation programs as well as other things that we are doing in the community. So we will use that day to make sure when the Action team is out that they're sharing information, when PIC is out that they're sharing information. And we'll be across the entire city on that day.
Thank you so much. And again, thank you guys for all the important work that you do. Anything that I can do to support either teams, I would love to do it. My passion is around mental health, and in particularly the community that I live in. We're experiencing a lot of folks who are dealing with mental health in the Clinton Avenue area. So it always excites me when I see you guys out in community. I may not say anything, I keep writing, but I'm like, okay, I see them out here. And then the next question I'm going to be asking across here and both MBD, and I'm not sure, but can you give us any updates around what's happening around Peace Village?
No further updates from what we discussed in the work session, and happy to put that in writing so that everybody has it.
Thank you so much.
We'll go down the line so everyone can ask a question here. I'll start with Councilmember Monroe. I just want to note the time. It's 12:45 and 11:45, pardon me. And whenever we're done with these questions, we'll take our lunch break and then come back for fire right afterwards. Councilmember Monroe?
I'll just make a quick comment that one of the work sessions we had was regarding how the city will be working with unhoused people. And I was very heartened to learn that, you know, where it might not necessarily be our duty to do this piece, where so much of this comes from the county, the fact that we're stepping in and doing that coordination between agencies to make sure we have a better sense of who's doing what and where they're deployed, it was great to hear. And I'm excited to see how this progresses over the coming, year. So thank you.
With the funding for Daniel's Law, congratulations. Is it being used to hire the new six peer navigators?
Yes, so we are going to hire 6 full-time peer navigators, 1 navigator supervisor, and then 1 on-call. Those folks are on.
Perfect. And is our Action team staff 24/7?
No, they are not. I believe when we got the initial report, the recommendation was 24/7, but we made it clear that we were not rolling out Action team at this time as 24/7.
Thank you. What are their hours?
7 a.m. till 9 p.m. Monday through Friday.
Thank you. And with the creation of the new advisory committee, how will community be invited to participate? Who will it be open to?
So we're working on that right now. We do want representation across the community. We have partners that we work with now. Certainly we want to have them. And we've also talked about having someone with lived experience, someone who has had access to PIC particularly. So we are looking for a variety of people to serve on that advisory.
Very exciting. And final question, and this will have to be in writing. The way it's set up, it doesn't necessarily specify whether, so I'm looking at page 20, which departments of crisis intervention that staff will be assigned to. For some of it does, but with crisis intervention services, I know there are victim services and other things that are included. Is it possible to provide a more detailed breakdown on how staff are distributed across the various crisis services?
So we can get you something.
Awesome. Thank you so much for all the work you all do.
President Melendez.
Yes, thank you. So when we had ARPA dollars, I know there was a lot of effort to support workforce development initiatives. Got the truck, got some other things going. Can you talk about how this budget will continue to support workforce development efforts across the city? Are there going to be significant changes? I see that there's some shuffling in staff, but wanted to get a better understanding of it.
Yeah, so the funding right now that we have for ARPA is on organizations and agencies workforce development work. So those grants and ends. But what we are going to do is do the development. So that workforce analysis, the gap analysis, about us.
Sarah, will you talking to the mic, please?
Sorry. Talked about us being a connector, which is basically connecting organizations, people to organizations, organizations to businesses, things like that. A convener, which is bringing big groups of together, like that Dr. Green is leading. A supporter, letters of support, trying to advocate for what's needed in the workforce development space, and I think most importantly, a representer. So really looking at making sure that city residents' needs are a part of big economic and workforce development initiatives.
I do want to add that you said some changes. One of the changes you probably note is AmeriCorps was
I was just going to ask that next. Go ahead.
Set apart, and because AmeriCorps is around workforce development, that is now under our workforce development coordinator.
So in spite of whatever's happening at the federal level, we're continuing to try to support those efforts?
So we have, I believe, 16 volunteers under AmeriCorps with the current grant that we have. 15.
Got it. Okay. That's it for now. Thanks.
What qualifications and training do the community responders receive?
So the community responders went through a series of training with REOC. We provided the breakdown of the training that they received at the time when we initially started. And then throughout the year, they have participated in training with the county as well as Center for Dispute Settlement. So as we see trainings, we continue to enhance their needs. We extended our contract with REOC for refresher. After a year, you may need a refresher on some of the things that they went through with the training. So we will continue with that partnership with REOC as well.
That's great. Would you provide, even though it sounds like you've provided some of it before, but provide the trainings that they receive in writing?
Yes.
And the qualifications for that position. How are we receiving or seeking out feedback from the community around PIC response and action team?
Yeah, we're certainly working on a way to collect data from people that have used our services. As you can imagine, it is hard to collect that information. You're working with someone in a crisis, so sort of how can you get that information from them? But we're really going to spend a lot of time this summer, and especially with the community advisory committee that we're going to start,
to really look at better ways for us to collect qualitative success stories also, as well as quantitative data.
Yeah, what came to mind was like, an automatic text that could go out after they've called for the services or something like that. Because I think that would be really valuable, and I'm happy to see that you're restarting the advisory committee, because I think that is also really valuable to make sure that the community feels like they can have impact on that work and how the team shows up. I think that's all my questions.
The action team started in September of 25, correct?
So we hired our manager in February of 25.
Okay.
But then we hired the responders August, September of 25.
Got it. Because I don't see a year-over-year comparison. I know it may have not been in the original budget, but I also don't see any past costs.
So the action team originally started in the mayor's office.
Okay.
And we moved it to Dries, so you now see it shown in the Dries budget.
Got it. So would we have seen the cost of it from last year in the administration?
That's correct.
Okay, got it.
We, in the current fiscal year budget, though, we had not added the positions to the table of organization. So the only positions you would have seen were the 2 full-time supervisory positions in the mayor's office.
Okay, got it. If we could just get, I'm just curious what it costs for startup in that last year versus what we're projecting for this coming fiscal year, that would be helpful.
Sure.
Also, your department, Dr. Green, doesn't run 211, correct? It's not run by the city.
No, it's run by Goodwill, but we have a contract with 211.
Ah, okay. Can you speak about that contract? What does that entail?
Yeah, so when PIC first started 5 years ago, almost 5.5 years ago, it was really important that we had 211 be able to dispatch us. So they've always been part of this conversation. They were part of our advisory committee before. They will be part of our advisory committee moving forward. So they're a really strong partner. So yeah, we've had agreement with them since January of 2021 to dispatch PIC, and there's workflows that we have with them and not call types, but different situations that they refer us out. Thankfully, Goodwill actually also has the 988 contract, so it's a seamless way to make sure that folks call 988 to get PIC as well.
Got it. And what does that mean for budget implications? Is Goodwill paying the city to respond, paying the action team to respond? No.
So action team is not
just a partnership.
It's just a person in crisis team. And so we pay them to dispatch us.
Got it. Okay, so we would see that in expenses, not in.
Yeah, so it's a professional services agreement, and there's no changes to that agreement this year.
Got it. And then the action team, I see it in all caps across this budget book. Is it an acronym?
No, it is not.
Okay.
Let me make that clear. No, it is not an acronym.
Okay.
And so you do see it both capitalized and lowercase.
Yeah.
And we've been trying to fix that to make sure it's consistently lowercase.
Got it. Okay, thank you. And then how do you determine who is going to serve on the community advisory team for action? And is that community advisory team for both PIC and action, or just?
It was just for
PIC. Just for PIC.
And that was part of the requirement in the grant that we applied for Daniel's Law. But we're also in the midst of an evaluation, and we've talked about it there as well. Mm-hmm. But it's just for PIC. We do have an internal advisory team that works with us for action. It's all city employees that helped us with getting it started. We have Neighborhood Service Center, we have RPD, we have ECD, we have I believe we have someone from Office Violence Prevention. We have Sarah on the team, so it's an internal team as we're trying to develop.
Got it. And how do you decide for the advisory team for PIC?
Yeah, we're still developing what that looks like. And so we will certainly have, as Dr. Green described, folks with lived experience, people who are experienced in this field, our shares folks that have ECD, internal folks, RPD, and we're still we're going to spend the summer really fleshing out what that looks like.
Great. If you could just share with us, as you guys have determined, and if there's a way that we could potentially submit names of folks, particularly people with lived experiences that might be beneficial to serve on that team, that would be great.
So I would say if any of you have someone that you would like to recommend, you can feel free to send the name to us, because as we're building it, we may say we're looking for someone in this field, and you submitted someone in that area that will help us.
Okay.
Feel free to submit names.
Will do. Last question. I know that there was a lot of concern from the Locust Club around, it was already mentioned here, with the action team. Has there been any thought around partnership? RPD is low on officers. I could see the action team potentially being a pipeline for potential officers, for folks who have an interest in going on. Any unique collaborations like that?
I think given the outstanding matter that we have, I'd rather respond to that in writing.
Okay, thank you.
Vice President Harris.
Thank you. I had a moment to look at the, and by the way, thank you for providing this, because I don't recall the workforce development gap analysis. I don't recall seeing it, so I had a chance to look at it real quick, and thank you for providing that. I just got a question, and how does this budget address, or how does it enfold the workforce development unit that we use ARPA money to purchase? How does that unfold into the new process?
So we will continue to utilize the mobile unit as part of the work that Sarah mentioned. So Rock the Block, they'll be out. When there's events in the community, we're invited to. You usually hear tabling, but we have our mobile unit out on the streets. When there was a need for SNAP clinics, mobile unit was available to support any agency who was doing those things. So the mobile unit will continue to be out on the street. I believe they're out at least weekly, but there's also an online request form agency.
Okay, because I didn't notice that you had anything listed in here. No, I'm losing my voice. I'm sorry. I didn't notice that you had any allocation of staff for the mobile unit listed in here. That's why I was asking.
So the two staff members that are in workforce development, they are the two members who drive the unit.
Okay, thank you for clarifying. And I think that pretty much. So that would help. Actually, that would help with removing transportation barriers and continuing to bridge the skill gaps in our communities. Okay, thank you. Thank you very much for all that you guys do. Really appreciate you.
Just a question and a comment from me. Question: the mayor had talked before he left about wanting to, prioritizing pick and action being reimbursable through Medicaid. What are the steps to get there? What will be accomplished this year towards that end?
So I think after we get through this budget process and state passes its budget, process begins again, and that we will consider what steps are appropriate, how we advocate for that, and we'll certainly keep council updated on that process and ask for your advocacy as well.
But that will be essentially through direct negotiation with New York State DOH?
I think we would have to initiate a conversation and go from there. So not sure what the process would look like, but certainly something that, as the mayor has said, we look at every tool in the toolbox that we might be able to use, and pursuing that would certainly be one.
Yeah, I think it'd be huge, and I think there's great opportunity there. So certainly if we can provide some joint advocacy, we'd be happy to. Lastly, just thanks to the whole team for all the work that you do. I've said this before, but I see the work of this department more through the eyes of little kids now, and just you do incredible work. And thank you so much. Thanks for being here, Commissioner Green. And this mostly goes out to Eric Rose, but go Knicks. Knicks and 6. All right, we'll come back for lunch at 1 o'clock. Thanks.